Hi, angels. So my video is going to end up being a little bit different. I was going to do an update. I told you I'd do an update every day about the information I found out about Canada and mostly my area, which is Ontario. And I was going to update you on, how many cases because there was a whole bunch that came in last night. Where they are, um, the age and gender and all of that. And I'm also going to explain to you the process of how the initial screening takes place. But just now at 5:30, it's 5:50 now. At 5:30, there was a press conference with the oh, what's her name? Dr. Tam, explaining some things. So what I'm going to do is I'm just going to do a quick rundown of what I found, and then I'm going to show you parts of the press conference. Okay. So if you want to hear some of the information that I have researched and watch the press conference from part of the press conference from Dr. Tam. Um, there's some really boring parts in there that I cut out. So if you want to hear any of that, um, then stay tuned. See you in a minute. Hello, angels. Okay, so um, I'm gonna cut a bunch of stuff out. I'm gonna try and do just a quick rundown of the information I have, and the only reason I feel it's important to name off the ages and where these people are and where they're from is it kind of gives us an idea of where the concerns are, and where you need to watch for. And there's a couple of places in here that are most of the uh, are the most isolated areas for the virus. So I wrote it all down so I wouldn't forget anything. So, and then after I'm done, I'm going to add the parts of the press conference from Dr. Tam, okay? Because I did this last night. I was going to upload it this morning, but I was unable to do that. Um, yes, yes, baby bear. So, anyways, in uh, within just last night alone, we developed what was it? Well, there was 39 more cases overnight, but we are now up to 319 cases, and over 25,000 people have been tested. Um, anyway, so the first thing I'm going to explain is the assessment process, the screening process. So the process begins with an initial screening covering the patient's symptoms and recent travel history. If the screener is positive, a nurse will perform a brief exam, including testing blood pressure. That information is passed on to a doctor, and that's when the doctor will make a decision to swab or not to test for COVID-19. And the tests usually take about 24 hours. Um, let me guess. Baby bear again. For those of you that aren't subscribed yet, you're probably wondering, she is a freaking crazy person. No, most people that know me, that follow me, know that I have a special needs 7-year-old son who takes up a lot of my time. So yes, I get interrupted quite often. Okay. So, it's important to know that your designated test site is located. Doctors are also advising that that people in general are not to show up in emergency rooms. I do know that here in North Bay, they they were limiting the visitors, but now I think they're outright not allowing the visitors, depending on like if it's palliative care or something like that. But the emergency rooms have gotten so fucking ridiculous. People get, you know, a sniffle and they start freaking out. So the emergency rooms are getting overpacked, and you know that's, people are going to get sicker that way, not thinking before they do things. And there's people that go in there with serious injuries that they need to focus on. So, you know, people need to calm down and think logically before putting themselves at risk, because I get that in the face of fear, people panic, and that's the worst thing that you can do. Um, so we need to be careful about not overburdening the department, so we can look at the very sick people, is what they said. So as of March 15th, which is today, there was 142 positive cases of COVID-19 reported in Ontario. 137 of these are currently in self-isolation at home. The rest are recovered. But that just went up, and they did say that this is the fastest skyrocketing amount in one day that we've had since this all started. And it's mostly in Ontario, BC, and Alberta. The surge in cases comes after officials confirmed 24 new cases in the province on Saturday, but that amount went way up. As you can tell, we're up to 319. And there are a lot of cases that are still pending. So today's update marks the biggest single-day jump since Ontario Public Health began tracking the cases of the 39. And remember, this is from before 5:30. 5:30, there was a new news release. Dr. Tam and other stations like CTV News and The Nugget and places like that confirmed a lot more. But as of this time, there were 39 new cases. There are 14 in Toronto, 5 in Peel, 5 in Ottawa, 3 in Hamilton, 3 in York Region, 2 in Waterloo, 2 in Durham, 2 in Simcoe, Muskoka, 1 in Niagara, 1 in Haliburton, Kawartha, Pine Ridge, and the location of 1 case listed as pending. All but 1 case is currently observing self-isolation, with exception of a patient from Muskoka, or Simcoe, Muskoka. That person's been hospitalized. The method of transmission has varied, and it's also pending. The virus is listed as pending for all patients except for a woman in her 50s from Niagara Region who had recently returned from Egypt. On Sunday, Niagara Region Public Health and Emergency Services said that patient is recovering at home in isolation. Ontario Public Health says that 8,462 have been tested for the virus so far. That's actually over 10,000 now. The agency is awaiting the results of a remaining 1,316 tests, which also raised. The legislation would include direction to employers to ensure protected leave and remove the requirement for employees to obtain sick notes prior to taking time off for self-isolation or quarantine, or to provide care for those who are in self-isolation or quarantine, according to the spokesperson. This is coming from Florida. It's about fucking time. That's all I can say. It's about fucking time you did something right for the people. Yes, I don't like him. He has hurt our funding for our special needs children. He has cut back on teachers. He has cut back on all the things that this country is demanding, that we fucking need, that is desperate. He's taken away the things that we have to have and using it for things that we don't fucking need. And probably most of it's going in his pocket. And yes, I said that. You're a fucking asshole and all you care about is your fucking money. Sorry, rant over. Okay. The province is expected to provide an update on the cases in Ontario at 5:30, which I'll be showing you shortly. So, like I said, you'll notice a lot of these places are isolated. So, as of Toronto, there were, before 5:30, 142 positive cases of COVID-19 so far. 137 of these patients currently remain in self-isolation while the rest are recovered. So here's what we know so far before 5:30. 39 new cases reported on March 15th, including 14 in Toronto and several in Hamilton. The method of transmission is listed as pending for all patients except for a woman in her 50s who returned from Egypt. 24 cases were reported by Ontario's Ministry of Health on March 14th, including 9 cases in Toronto. The ages, genders, and sources of transmission have not been released for the Toronto patients. Okay, let's skip all that, and we're going to go to the United States. So 2 women and 2 men in their 60s had traveled to the U.S. Another man in his 60s traveled to the U.S. and Washington. A man and a woman in their 20s. A man in his 40s. His transmission is listed as either being through travel to the U.S. or through close contact. Another man and woman in their 40s. Another woman in her 40s in Colorado, and a man in his 40s in Las Vegas. A woman in her 70s, she was treated in Mississauga and had recently traveled to the States. A man in his 30s and a husband and wife, both in their 60s, who were aboard the Grand Princess cruise ship out of San Francisco. Egypt. So there was a man and a woman in their 70s had traveled to Egypt. A man in their 70s, a woman in her 70s recently returned from Egypt. Her transmission was through close contact. A man in his 80s, he was on a tour in Europe. In Egypt, sorry. Now I'm going to Europe. A woman in her 20s, although she was in Europe, they don't know the exact destination, which is not good because they don't know who she came in contact with. Switzerland, a man in his 40s, recently traveled there. So I'd say Egypt was one of the big ones. This Iran is another one. There's a couple in there, a woman in her 70s and a man in his 80s, both traveled to Iran. 2 men in their 50s returned home from Iran. A man in his 60s had recently returned home from Iran. A man in his 60s who had traveled history to Iran. His transmission, though, was through close contact. A man in his 50s that went to Iran. And a husband and wife in Toronto. She had recently traveled to Iran, but her husband didn't go with her. Hopefully he didn't get it. GTH8 cases, which, if you guys don't know what that is, that's the general Toronto and Hamilton area. I believe it's Hamilton. A Halton woman in her 50s who traveled to the States. Woman in her 40s in Halton region traveled to the States and Costa Rica. Woman in her 30s in Halton region went to Hawaii, and she sought treatment in Hamilton. So she probably came in contact with quite a few people. A Durham man in his 50s. He had traveled to Asia along with another woman in her 60s. And then they wonder why this virus is like growing so quickly. A Durham woman in her 70s had been to multiple locations in Egypt, and multiple locations including Egypt. A woman in her 20s in Peel region. Now this is all Peel region. Her transmission is listed as possibly being through travel, but they don't know the destinations. A man in his 50s who returned from Germany. A man in his 20s was also through travel, but they don't know the destination. Woman in her 60s, she could either have gotten it through travel or close contact, but again, they don't know where she traveled. This is the part that's freaking me out. A lot of people, they don't know their destination. How could they not know their destinations? So we're just waiting on more people to come up that have it. Another woman in her 20s, they don't know her destination. and a female under the age of 18. Her transmission was through close contact. In York region, a woman in her 20s, destination not known, husband and wife had went to Iran, and a man in his 50s had went to Iran. Hamilton, a man in his 50s, again, travel destination unknown. A Vaughan woman who recently traveled to Egypt. Brampton woman, both of them were in their 30s, close contact of a previously confirmed case. Richmond Hill woman in her 60s who returned from Iran, another Iran. 2 more cases were confirmed on March 3rd in the Toronto area. Their agent enders have not been released, but a spokesperson for the ministry said both residents have travel histories of Iran and Egypt. A woman in her 60s, Egypt. She returned to Toronto, was treated for symptoms in Richmond Hill. There was a husband and wife in Ajax, returned from Iran, but her husband did not go with her, so I'm assuming the wife came to the husband. Newmarket, woman in her 70s, Egypt. Cases outside of the GTHA area. So this is, so I'm just give you the names of the places. So there's Niagara, Muskoka, Eastern Ontario, Haliburton, Waterloo, Niagara, and they're mostly people that are elderly. And the places are Egypt, the U.S., Portugal, the cruise ship, and a lot of these people, they're pending, or they were destination unknown, or close contact. That's getting a little ridiculous. And then, of course, you guys know about Sophie Trudeau, a prime minister's wife. They're assuming she got it because she returned from the UK. Waterloo, woman in her 60s, traveled to Puerto Rico. An Ottawa woman who came from Italy. A Waterloo man, United States. Simcoe County man, traveled to Spain. Ottawa man, traveled to Austria. Sudbury man, attending the mining conference in Toronto, which is where those 5 people at my school, the employees at my school, got sent home. And the 6th man was from Sudbury, and he was tested positive. And then Kitchener woman who traveled to Italy. Recovered cases. On March 10th, officials said one of the previously active Toronto cases had recovered, but did not specify which one. A Toronto woman in her 20s who had recently returned from China. A woman in her 20s who was a university student in London, Ontario, who had also just come back from China, and a husband and wife in their 50s who were also in China. So, the thing that concerns me is the pending and the travel destinations unknown. Like, how could you not know where you've traveled? So, I am, as much as these cases have skyrocketed in just one fucking night, I am terrified to know what it's going to be like next week. Our school is shut down. They're actually even starting the 24th, they're starting online classes so we can do the rest of our schooling from home. I am not taking Asen anywhere. I know it's going to eventually come here. It's inevitable. It started off with just a few places, and now it's fucking everywhere. And in Ontario, it started off in Toronto, and now it's escalating. And I'm not taking chances with him. He already has a fever. I do not think at all it is from the coronavirus. But I'm definitely keeping an eye on both of us because I told you, because my son has special needs, and we're always with doctors, therapists, programs. His respite worker goes to Toronto. She hasn't been there in a while, but she goes to Toronto. She's a cancer, she's in remission, and she goes there once every 6 months to see her doctor. She was supposed to go this weekend, but I talked her out of it. I was like, you got to be fucking crazy. So she's not going, thank God. But it's inevitable. So I just, before I add the video, just, guys, please, please. I know a lot of you are saying, relax, everything's fine, chill out, whatever. You know what? You can do what you want to do, but a lot of us have children, and even more of us are single parents. I don't have anybody. I have my respite worker who watches Aislinn, who we've become close to, and I have a couple of good friends here, a couple, but we don't have anybody. We don't have support anywhere. So yes, I'm going to be calm and smart about it. I'm not going to panic, because fear and panic cause chaos, and it can be dangerous. So, but I am going to isolate us as much as possible until we get some more news. But all I'm saying is, like, some of these people I've seen on the news, some of these people are going to museums and like national parks and things where there's a lot of people with their children. I get, like, nobody understands better than me about isolating our kids. My son is special needs. He has severe ADHD, behavioral problems, among other things. Asa being cooped up in a house is like having a fucking tiger in the house, ready to just charge. Literally, okay? But, like, thank God we have a backyard and we can go for walks around our neighborhood. But there is no way in hell I'm taking my son to an outing where there's a whole bunch of people and taking so much as 1% risk of his life. No fucking way. Be smart, people. There is a lot of fun things you can do at home. It's actually, you know what? This is the perfect opportunity to have some family bonding, because I guarantee more than half of you people, and I don't mean this disrespectfully because I'm just as much to blame with going to school and working, we don't have enough time with our kids. This is a perfect excuse for you to bond with your children. Play games, do arts and crafts, paint, color. Aislinn loves building these. I get him boxes from Tim Hortons, and he builds the coolest little houses for his cat TJ, and little dishes, food dishes, where they have contraptions and like compartments, and it's just, he's so creative. Like, do something fun with your kids. Use this as a positive thing. Make this a positive thing. So just be smart, be safe, and just keep aware, keep updated. And if I get any more information, which probably will daily, I know these videos are probably boring, but I know a lot of people out there, they don't have access to certain things, or they're too busy to read or watch, or they've got little ones to worry about. So I tried to get as much information as I can, put it in one video, so you guys can sit there and do what you need to do, whether it's cook or clean or play with the kids or whatever, and just listen to what I'm saying. And that's the only reason I'm doing it, is to try to update those who need help getting updated. So anyways, here's the video. Mommy Bear loves you all. Stay safe.
Good afternoon, everyone. Bon après-midi.
And we already have 2 people that have queued in for questions.
I'm Dr. Teresa Tam, the Chief Public Health Officer of Canada. Je suis Dr. Teresa Tam, l'administratrice en chef de la santé publique du Canada. As of right now, we have 313 cases of COVID-19 in Canada. All 10 provinces have now reported cases. Ontario saw the largest single-day increase to date. We now have 4 confirmed cases among the passengers repatriated from the Grand Princess or in quarantine at CFB Trenton. Canada has tested close to 25,000 individuals to date. Internationally, Europe is the epicenter of the outbreak. With cases rapidly increasing in Canada, particularly in British Columbia, Ontario, and Alberta, our window to flatten the curve of the epidemic is narrow. We all need to act now. COVID-19 is a serious public health threat. While this disease is particularly serious for older adults and medically vulnerable people, all ages are at risk. Let me be very clear. Today, I am asking everyone to take strong action to help us delay the spread of COVID-19 and protect as many people as possible. For the public, this means postpone or cancel all travel outside of Canada that is not absolutely essential. I strongly recommend that all travelers coming from outside of Canada take the additional precaution to self-isolate for 14 days. I am also asking that you avoid large public gatherings and increase your personal physical space from others. Talk to your employer about contingencies for working from home if this becomes necessary. And I cannot stress enough, if you're at high risk of severe illness, practice social distancing and separate yourself whenever and wherever you can. Everyone else needs to make sure to take all precautions to protect those at high risk while ensuring that they are fully supported and not isolated. This is our chance right here, right now. We need to act now and act together. Thank you.
Merci et bon après-midi à tous. Je suis le Dr. Howard New, le sous-administrateur en chef de la santé publique. À l'heure actuelle, nous avons 313 cas de la COVID-19 au Canada. Toutes les provinces sont maintenant signalées des cas. L'Ontario a connu la plus forte augmentation en une seule journée à ce jour. Nous avons maintenant 4 cas confirmés parmi les passagers rapatriés de Grand Princess qui sont tous en quarantaine à la BFC Trenton. Le Canada a testé près de 25 000 personnes à ce jour. Au niveau international, l'Europe est l'épicentre de l'épidémie. Avec l'augmentation rapide des cas au Canada, en particulier en Colombie-Britannique, en Ontario et en Alberta, notre marge de manœuvre pour aplatir la courbe épidémique est étroite. Nous devons tous agir maintenant. La COVID-19 constitue une grave menace pour la santé publique. Bien que cette maladie soit particulièrement grave pour les personnes âgées et les personnes médicalement vulnérables, tous les âges sont à risque. Il faut être très clair. Aujourd'hui, on demande à chacun de prendre des mesures importantes pour nous aider à retarder la propagation de la COVID-19 et à protéger le plus grand nombre de personnes possible. Pour le public, cela signifie reporter ou annuler tous les voyages à l'étranger qui ne sont pas absolument essentiels. On recommande vivement à tous les voyageurs venant de l'étranger de prendre la précaution supplémentaire de s'isoler pendant 14 jours. On vous demande également d'éviter les grands rassemblements publics et d'augmenter votre espace physique personnel par rapport aux autres. Parlez à votre employeur de la possibilité de travailler à domicile si cela s'avère nécessaire. Et on ne saurait trop insister, si vous êtes à haut risque de maladies graves ou mortelles, pratiquez la distanciation sociale et séparez-vous en tout temps et partout où vous le pouvez. Tous les autres doivent s'assurer de prendre toutes les précautions nécessaires pour protéger les personnes à haut risque, tout en veillant à ce qu'ils soient pleinement soutenus et non isolés. Ceci est notre chance, ici et maintenant. Nous devons agir maintenant et agir ensemble. Merci.
Merci, Dr. Tam. Thank you, Dr. New. We will now open the floor and the telephone line to questions. We'll go with the first reporter on the room, and then we'll go to the phone.
Good afternoon, Stephanie Levitz from the Canadian Press. Quebec took the stand today to ban all large public gatherings, to shut down pretty much every public space, limit restaurants. Are you suggesting that other provinces follow suit?
But that is, of course, up to different individuals. I have just met with all the chief medical officers of health, and I can just say that they're all considering these types of measures. And we discussed, for example, consider that all mass gatherings or all gatherings, 250 persons or over, should be postponed or canceled. These are some of the really key things that they're all actually thinking through right now.
Should the government close the border?
So right now, we, as you probably have heard, that as of Friday, we asked that people don't go outside of Canada unless it's absolutely essential, and that when you come back, you self-isolate. We have to maintain essential movement of people and services as well. And I think that the key for every country in the world, it is a global response, that they need to essentially contain the outbreak within their own setting. But it is very important to maintain really essential services and goods and movement of people.
The border, though, become mandatory, and should self-isolation become mandatory, given what we know about the sort of moving hotspot of this virus?
As you've actually said, that essentially almost the vast majority of the world has reported at least some cases of COVID-19. So our measures must be broad, which is why we are asking that all travelers who come back self-isolate. This is not essentially ordered. This is a voluntary self-isolation. It is impossible to be essentially keeping tabs on every single traveler that come in. This is a social phenomenon. This is a societal response, and everybody must take that responsibility. Public health is going to do what it can. It cannot be essentially maintaining that kind of linkage, if you like, surveillance and daily monitoring that we'll be intensively doing for different areas of hotspots. Is now everything. Every traveler should self-isolate.
One more question in the room, and then we'll go on the phone. If you have any questions on the phone, please press *1. Une dernière question dans la salle, et puis nous irons au téléphone. Si vous avez des questions, appuyez sur *1.
Testing at the moment seems to still be linked to those who have traveled from a hotspot or have sort of known contact. At what point does that expand to just starting to test people if they present with the symptoms but have not traveled? Reports coming from overseas seem to suggest that many people, for example, can be asymptomatic and still be transmitting the virus.
This is already happening now. So as I've said, Canada has tested more people per capita than so many other countries. So over 25,000 or around 25,000 people have already been tested. The testing criteria in the provinces is broader than travelers. So clinicians can make their own flexible judgment as to who they should test. But certainly testing people who are hospitalized, who are seriously ill, no matter whether they've traveled or not, is one of these key measures. Long-term care facilities, for example, are particularly important. We want to protect those who are sick. So any outbreak that looks like influenza or COVID-19-like symptoms, we don't really regard whether there's a travel history or not, for example, that people should be testing for those types of presentations. So there must be a flexibility afforded to clinicians to be able to test anyone that they suspect may have COVID-19. But certainly specific jurisdictions do have their protocols, but the net has been casted wider than just travelers.
Operator, let's go on the phone.
Thank you. Merci. Ladies and gentlemen, mesdames et messieurs, nous allons maintenant passer à la période de questions. We will now take questions from the telephone lines. If you have a question and you are using a speakerphone, please lift your handset before dialing your selection. Si vous avez une question et vous utilisez un téléphone main libre, s'il vous plaît, soulevez le combiné avant d'effectuer votre sélection. Si vous désirez poser une question, appuyez sur les touches étoile 1 de votre clavier téléphonique. If you have a question, please press *1 on your telephone keypad, and you may cancel your question if you wish by dialing the # sign. Vous pouvez annuler votre question si vous voulez en appuyant sur le dièse. S'il vous plaît, demandez seulement une question et une question suivante. Please restrict yourself to one question and one follow-up question. S'il vous plaît, appuyez sur l'étoile maintenant, sur étoile 1 maintenant pour poser une question. Please press star 1 at this time if you have a question. And the first question is from Marika Walsh. La première question vient de Marika Walsh at Globe and Mail. À vous la parole. Please go ahead.
Hi, thank you. I'm wondering if you can explain clearly what information travelers arriving in Canada are getting. We're hearing constantly all weekend that they're not being told to self-isolate. So please tell us what they are being told specifically.
So this is, as everybody can appreciate, a rapidly evolving situation. So we will be using many different channels to get the message out for returning travelers from outside of Canada to self-isolate. And we are rapidly updating all of these messaging, including at airports. Right now, you may not see that message as yet. Prior to this, we've been asking everybody to self-monitor. That message is changing now to self-isolate. And so we appreciate all journalists and reporters to get this message out for us as well. Thank you.
The message, though, on Friday was to self-isolate if you were returning from Canada. So why was that not given at the borders?
That is rapidly being implemented right now. That is absolutely true. Very important.
Thank you. Merci. The question suivante vient de. The next question is from James Keller at Globe and Mail. À vous la parole. Please go ahead.
What do you know about the number of ventilators currently in Canada across the country and our ability to scale that up if the need increases?
So this type of planning is underway very much in real time in the various jurisdictions, and that is in the jurisdiction of the provinces and territories. But based on my connections with all the chief medical officers of health, I know that all of that planning is going on. What we are facilitating at the federal level is to provide surge capacity or to assist with purchasing of equipment should they be needed. So I do know that things like ventilators, personal protective equipment like masks and gloves and such, hand sanitizers, and laboratory type testing equipment or swabs, those are all part of the federally facilitated, coordinated purchasing mechanism.
Thank you. Merci. The next question is from, la question suivante vient de Annie Bergeron-Olive at CTV News. À vous la parole. Please go ahead.
Hi.
You're cutting out.
I beg your pardon. Annie Bergeron-Olive, please go ahead. Your line is now open.
Hi, can you hear me?
Yes.
Okay, perfect. I'm hoping you can just tell me and clarify, if somebody does get COVID-19, how long should they self-isolate, and how long does some individual remain contagious? There were some reports today that potentially the virus lives within you for up to 37 days.
So obviously the science is rapidly evolving, but we do know that really persons with symptoms are the most infectious. In most jurisdictions, we are still testing for people who are COVID-19 positive with a negative test at the end to determine if they still have a positive test detection. Now that policy could change because we now know based on science that people are most likely to be infectious with it if you have mild illness, so that these are people staying at home. If you have mild illness, that it may be around 8 days since the symptom onset that you remain infectious. That science is still evolving. And I think jurisdictions may still be testing people at the end of their clinical period, but that may or may not be necessary depending on the evolving science. So for sure, if you're symptomatic, you have to self-isolate at home if you have mild illness. Of course, if you have more severe illness, call ahead to your health line, health provider, in order to be seen and potentially be hospitalized. I think those who are hospitalized will be isolated in the hospital until they're essentially discharged.
As a follow-up, the way I understand it is in Ontario, if you have recently traveled and have come down with symptoms, or if you have come in contact with somebody who has been confirmed with COVID-19, you cannot actually get tested. You're told not to come in and get tested and to stay home and isolate. In that case, for somebody who has not been allowed to get tested and is at home with symptoms, that perhaps is not bad enough to be hospitalized. How long should they remain at home to be comfortable knowing that they will not transmit the COVID-19 to somebody else? Because in that instance, they probably wouldn't be able to get a negative test because they haven't had a test in the first place.
Yes, so that is actually part of the evolving science. I think on the conservative side, if you have symptoms and maybe you're not tested, for sure you should never venture out if you're symptomatic, even with mild symptoms. If you want to sort of be really cautious, again, maybe even thinking about 14 days, that is probably precautionary for someone who have mild symptoms, but that length of period will be evaluated as well.
Thank you. The next question is from Reza Patel at CBC Politics. La question suivante vient de Reza Patel at CBC Politics. À vous la parole. Please go ahead.
So I have a question about airport screening specifically. Travelers are telling us that they're only being asked on a screen whether they have traveled to Iran, Italy, or China, and that's when further screening measures will take place. Why are travelers not being asked if they have traveled anywhere else, given that we are now in a global pandemic?
I think that's precisely why we're asking all travelers now to voluntarily self-isolate. It's basically every traveler from outside of Canada. We are still currently maintaining additional screening question on those machines, the immigration machines, for now, for the 3 areas that you just mentioned, Italy, Iran, and Hebei. That can be constantly reevaluated. But now you're no longer just focusing on these 3 areas. You're actually focusing on all travelers from outside of Canada. And I think that what you will see is that we're rapidly ramping up the communication on that front. These media briefings are just but one channel. We will be making sure that we have those messages out at all points of entry.
And at what point can travelers expect to see updated questions on those screens when they're coming into the country?
All of those planning implementation things are in planning, right? Everyone's working really hard at doing that. But just to add, though, that those machines are picking out people from just 3 areas. That question may and may not become relevant anymore when you have everybody that needs to pick up the self-isolation knowledge and information sheet. That's what we are planning to do.
Thank you. Merci. La question suivante vient de. The next question is from Guillaume Saint-Pierre at Journal de Montréal. Please go ahead. À vous la parole.
Bonjour. Le gouvernement du Québec a dit tout à l'heure que ce serait une bonne idée de bloquer la frontière aux touristes pour contenir la pandémie, donc pas évidemment les marchandises ou les citoyens canadiens, mais aux touristes étrangers, aux visiteurs étrangers. Quelle est votre position sur le sujet?
À l'échelle technique, on continue à travailler étroitement avec nos homologues de la province de Québec, c'est Dr. Arruda, avec le comité consultatif spécial. On sait que les mesures on met à la frontière, c'est une composante d'une approche intégrée avec aussi un système intégré de soins de santé et santé publique pour dépister, détecter rapidement les cas au Canada, aussi isoler et aussi faire un suivi des contacts. On sait que les voyageurs peuvent rentrer au Canada sans symptômes. Donc, ce qu'on fait à la frontière, ce n'est pas une garantie pour empêcher l'introduction du virus au Canada. Donc, aussi, il faut garder la frontière aussi ouverte pour les services essentiels. C'est ça ce qu'on discute actuellement parce que pour la fourniture aussi, le transport des personnes, c'est des services essentiels. Il faut aussi garder à nos frontières.
Donc, pour l'instant, vous ne pensez pas que de limiter le nombre de touristes, on parle bien de visiteurs étrangers, serait une mesure efficace pour contrer donc la contagion?
Ça fait partie des discussions à l'heure actuelle, mais ce qu'on dit, c'est important, c'est plus important à nos frontières, donner des renseignements, les informations importantes pour tous les voyageurs qui arrivent au Canada. Et comme on a dit, c'est important pour tous les voyageurs de savoir que c'est important de s'isoler, de se mettre en isolement pour 14 jours après leur arrivée au Canada, pour surveiller pour les symptômes.
Merci.
Merci. La question suivante vient de. The next question is from Brian Mullen at Global National News. À vous la parole. Please go ahead.
Hello. Following up on what Premier Legault announced yesterday, is it time to declare a national public health emergency, and what would that allow the government to do?
I think we, right at the outset of knowing about COVID-19, we have been, the whole of the country's public health system, and now many other departments, not just health, have been responding and preparing for this public health emergency or a pandemic, if you like, that WHO has declared. So we actually have been responding to it as such. And so some of the other sort of declarations that you've seen in other countries are for them to seek additional authorities, which could be financial. At least at the federal level, we already have the necessary tools and mechanisms and authorities to obtain the kind of funding and other authorities that we need, as you've seen the announcements from last week. So that is not necessary at this point in the Canadian context, but we're certainly evaluating the situation. Right now, as we know it, most of our cases are still linked to travel and their close contacts, but that situation could change very quickly. And so we will be evaluating this on a hour by hour, day by day basis.
Thank you. And from a health perspective, would reducing domestic and international air travel help contain the spread? Should airlines consider limiting flights within Canada and from outside Canada?
So I think we are essentially messaging today to everybody in Canada, and that includes anybody who works in Canada as well as anybody who is living in Canada to practice social distancing. So some of these concepts can be applied to travel as well. So the idea of being able to sort of maintain social distancing, especially if you're in a high-risk group, I think should be thought of carefully, even in the domestic context. So avoiding crowded spaces, mass gatherings, as such, should be considered when you're looking at the traveling context as well.
Thank you. Merci. There are no further questions registered at the moment. Nous n'avons pas de questions pour le moment. J'aimerais maintenant retourner la parole à M. Morissette. I would like to turn the meeting back over to you, sir.
Thank you very much. One last question in the room. Une dernière question dans la salle.
Respecting what you said about sort of increased signage going up at the border, and the need to keep essential people and goods moving, but why not close the border? I mean, knowing everything we know, why not say tourists can no longer come here and just shut it down? What's the science telling you about that?
So the science at the moment, if you look at the global epidemiology to date, and there's actually some studies to this effect, that countries that have enacted travel bans, for example, have not been able to keep out this particular virus. And you can probably see some of these countries as you look at what's happening in different places in the world. And so I think that we are driven by the scientific knowledge as of this point. But what is really, really important to make sure that the whole society, our health systems, are prepared to detect rapidly. We're still looking at contact tracing and be able to break all chains of transmission in Canada. The front end border is but one layer of protection, and it's never perfect. You can get people coming in different ways as well. And I think what the science is telling us and the publications on which countries have been impacted the most, some of them have actually been the ones with the most stringent travel and border measures.
I wonder then if you could just reflect on the science and the data sort of coming up against public perception and politics, and how the two things seem to be butting heads right now, where people are hoarding toilet paper and stockpiling when yourself, the Prime Minister, is saying, you know, the supply chain is fine. How should Canadians really be managing all of this? They're panicked. They're very scared.
So I think everyone can play their part. And so I think that I do want people to know that this is a serious illness. That's for sure. But that everybody can contribute to what we call flattening that epidemic curve. You do not want this disease transmitted rapidly. Whatever you can do to decelerate that transmission and to break those chains of transmission is really important. We can do something about this now. By these social distancing measures and avoiding non-essential gatherings or travel, we can dampen any sort of transmission within our society, which is the most important thing to do right now. And so while this is a serious illness, we want people to act. You can do something about it. And by acting, by increasing your knowledge, you're going to reduce that level of uncertainty and anxiety. So I think that all Canadians can do something about this and protect those who are most at risk and vulnerable. We really, really want to stress that. Make sure you do not transmit anything to your grandparents, to long-term care facilities, to hospitals. It's those kind of settings that, based on the evidence so far, can really, really impact a country. If we can do that, we can limit those kind of spread, we will really be able to reduce the level of severity and impact to this country. So really my message today is we have a chance right here, right now. We all do our part, act together in solidarity, and everybody take the necessary precautions and heed the advice of self-isolation, for example, if you've traveled outside of Canada. Thank you.
Thank you. That will be all for today's press briefing. Any additional questions can be directed to the Public Health Agency of Canada's Media Relations at 613-957-2983. La séance est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias de l'Agence de la santé du public du Canada au 613-957-2983.